Hi everyone, my name is Dr. Lisa Becht. I'm a double board certified reproductive endocrinology and infertility doctor here at HRC Orange County. I am in the Newport Beach and Mission Viejo offices, and I'm so excited to be chatting with you today. So I'm actually from the East Coast. I grew up in Connecticut, and then I was in Boston at Boston University for undergraduate. I was then in DC at Georgetown University School of Medicine, and then I moved to New York City for the rest of my training. So I did residency and fellowship at Columbia University, and then I stayed on there as an attending physician for 3 years, where I was a very busy infertility doctor, but I also was the director of egg freezing and Oncofertility. And then after that, I moved here to Orange County, and I've been at HRC for the last 5 years. I was always interested in helping patients, and so in medical school, I was really drawn to the field of obstetrics and gynecology. And then within that, we actually got the chance to rotate through different electives, and so I actually got to spend a month at a fertility center in Washington, D.C. It was so interesting. I loved being able to help a lot of the patients that came through the doors, and it was just such a invigorating field. Additionally, I've always loved the science and the technology aspect of medicine, and so specifically for fertility, there's just always changing opportunities, different things we can do and change in the clinical practice and the laboratory practice. And so in medical school, I was just so interested. And then from there, went on to OBGYN residency, where I confirmed I really did love fertility. And then from there, I went into fellowship, and now I'm here. Absolutely. So I graduated medical school in 2009, and even kind of those electives in medical school, I remember totally different kind of standard of care. So back in kind of that 2008, 2009, we were doing mostly fresh transfers, really without genetic testing. Nowadays, we almost always do frozen transfers. For most patients, we're doing pre-implantation genetic testing, otherwise known as PGT. So definitely the ability to have more information about the embryo is increasing our success rates, hopefully decreasing the number of transfers patients have to do. And then also just kind of for future pregnancies, we know a lot more than we did back then. So that's just the tip of the iceberg. There's been so many other technological advances, really more on the embryology side of things. But beyond that, on the clinical side, we've learned better protocols. Nowadays, we do a lot more kind of natural transfers. And we're able to still have good success, but also be able to minimize some of the medications that patients might have to take. So that's why I love the field. It's always changing. There's always new things to try and learn. And so I like to be very evidence-based, keep up with all the journal articles. That's one of the things I love about being here at HRC. We're affiliated with USC, and so we still get to work with the fellows there. We do a journal club every quarter, and so it's just great to always be up in all of the newest opportunities to know about that so I can offer it to my patients and get the best success. So day to day, I just love working with the team and with my patients. I love that every day is always going to be different, even though it's usually either a fertility patient wanting to freeze eggs or embryos or an infertility patient, but every single patient has a different story. So I just love getting to know my patients, kind of what brought them in, kind of what has their history to this point been, and then just seeing what I can do to hopefully get them success, whether that's going home with a baby now or potentially freezing eggs or embryos for hopefully future babies, or just counseling about their current fertility. I would say my absolute favorite thing in the day is a pregnancy scan. So we get to do that first pregnancy scan. We do it around 6 weeks, very early, just to confirm the pregnancy. We see that flicker, which is the heartbeat, and then we usually do scans in the 8th and the 10th week before we graduate someone back to their OBGYN. And so it's just amazing how from that 6-week scan to the 10th week scan, we see this little tiny heart flicker become this little kind of gummy bear moving around. And then that last scan in the 10th week, we're seeing the arms and the legs, and that baby's moving all around in there. So it's just amazing to have seen this patient, from when they were a new patient at a consult all the way through their cycle to then being pregnant, and then to kind of seeing their baby at 10 weeks, and then to come really full circle. Sometimes patients will come back for a baby visit where they bring their baby in. We get to meet the baby. And some of our amazing patients will come in, multiple times. So now we get to see their toddler and their older baby. In the past, prior to COVID, HRC always did the baby picnic, which was fantastic. We were doing that every year. People would come back with their HRC babies, and some of them were 20 years old. So there's been chatter that we're hopefully restarting that back up in 2025. So definitely something to look forward to. So we just love staying in contact with our patients and getting pictures and sometimes getting to meet their babies. So definitely I would say, I know it's a lot, it's very stressful, but, coming in here, that's the very first step. I know a lot of patients coming in, they're very nervous, but we're going to give you all the information you need. We're going to hold your hand. We're going to kind of get you through the different steps and then find out more information and use that information to hopefully be successful in reaching their goal. If their goal is having a baby now, hopefully they are walking out of the doors with a baby. If it's freezing eggs, hopefully that's preserving fertility for the future. So really my biggest piece of advice is, it's difficult, but, as much as you can try to center yourself and just know that you're going to have support through the whole process. So definitely a lot of things I would say set HRC apart from other fertility practices. I would say the biggest one is that we are all in-house, meaning everything you do is here at the HRC office. So that is everything from your ultrasound to your blood work. We have our own embryology lab here. Our embryology lab will do its own PGT testing. So really everything as part of that practice is here or through HRC. So we just know it's all high quality, and you can just rest assured that you're getting kind of the best practice and best technology. And then beyond that, in terms of myself, each of us doctors in HRC, we all work together, but we all have our own kind of practice within the practice. So, we have all different things that will set us apart, but I would say I really like personalized care. I will set your protocol if you're doing IVF or egg freezing specifically to you. We monitor. I like to do a lot of the ultrasounds. So people usually will kind of leave feeling like they really have personalized care and hopefully got the best results that we were able to give them based on their hormones. Again, I'm Lisa Becht here at HRC Fertility in Orange County at the Newport Beach and Mission Viejo offices.